There is no way I would be the same caliber surgeon without fellowship training. So the way it works is we have to go to school to become doctors. And then if you want to be a surgeon, you have to do a residency in a chosen field of surgery, and that's mandatory. But then what some people do after residency is they go and they do what's called a fellowship. And that's a training opportunity that you can do electively to hone in on a specific niche with very direct, almost one-on-one type mentorship. Not everyone does a fellowship, but that's because of a couple of reasons. One, they tend to be competitive, at least the good ones, so there aren't that many spots available, but also residency can be exhausting financially and physically. So there are a lot of people that when they're done with their 6-year residency, don't want to do additional training, they want to get out and practice, and that's understandable. But what someone might miss out on if they don't do a fellowship is that they may not realize that fellowship and residency are completely different training experiences. When you're a resident, you're there because the program needs a workforce. They need 10, 20, or 30 residents to make a program run. Someone has to take care of the patients, put in orders, do checks, and the residents are there because they need to be there to get certified to be a surgeon. They need to learn core principles and they need to get their certificate. But with the fellowship, it's totally different. You're there because you want to be there. They have you there because they want you there. They're taking a fellow so that they can pass on the legacy of a very, very specific skill set to another generation of fellowship trained surgeons. You find that both people just really want to be there. It becomes a very, very special year. And when I look back at both my fellowships and I think about all the training that I did, it was the fellowship years that taught me how to really think, because you're there and you're learning from these world-renowned surgeons. What you can do during a fellowship is you can actually understand why they're making the choices they're making, not just what they do, but why they're doing it. What are they thinking? I really just wanted to be the best possible surgeon I could be. I didn't want to leave anything on the table, and I didn't want to look back 5 or 10 years into my career and feel like I was lacking something that maybe I could have got through fellowship training. What I expect from myself is perpetual growth. I want to be able to look back every few years and feel that every version of myself is better than the previous version. Like Enzo Ferrari used to say, his best car was his next car. I want to constantly feel that. That's what drives me. That's what I chase. All right.